Mr. Jones, thank you for coming in today. So today's just going to be your report of findings appointment. So what we're going to do is we're just going to go through a few details of what we found in the last visit and what we're going to be doing moving forwards, and then you'll have a lovely treatment after that. How does that sound?
Sounds good to me.
So what we're going to be doing is we're going to be going through a few certain things. So we're going to go through what we found last time, your diagnosis, the plan and management we have for you, the risks and the benefits of care, the prognosis we've given for you. With prognosis, that means, how we think you're going to go from here onwards. We're also going to get stuck into a little bit of what happens if you don't decide to have care with me, and any questions you may have at the end. How does that sound?
Sounds good.
Perfect. Let's get into it. So last time at our last appointment, what we found was you were complaining of pain that was worse after work and just spending long periods of time in awkward position. Now, this pain is described as tiredness, achy, and morning stiffness, and it's relieved by painkillers, heat packs, and a few drinks, of course. So this leads us to a little bit of information into our physical exam as well. So what we found was you have a bit of abnormal posture with rounding of your shoulders forwards and also pelvic unleveling. So a little bit of misalignment throughout the body there. You also have tightness and tenderness of the mid to lower back postural muscles, so the ones that keep you nice and straight. And you also have spinal motion restrictions in the mid to lower part of your back. Now, this is where you're complaining of all your pain, so it does make linear sort of sense. In our orthopedic testing as well, we found there was a little bit of a positive test there for localized pain of the facet joints. Now, we'll go through what they are after this, just so you get a good grasp on that. So your diagnosis, it's a bit of a long-winded sentence here, but don't worry, we're going to break down the rest of this sentence right after I say it. So what we found was chronic mechanical mediated low back pain due to facet joint involvement with associated muscular hypertonicity and segmental restrictions. So what does all this mean? So chronic means it's been a long-standing, it's been around for a while. Mechanical mediated is referring to the pain source being related to your daily activities at work and also movement of your body. Sorry, let's put my laptop on charge here. And then the facet joint involvement. Now this joint is in your spine and it allows for movement and pain-free rotation, side bending, and also extension. If it's irritated like we found with yours, it will cause pain in these movements. And due to these dysfunctions, the muscles in your lower back have become tight, and in certain segments of your spine, it has reduced the movement. So this is why you're waking up feeling stiff due to the muscles and also the spinal restrictions. Now, I'll just go through now and describe just what the facet joint is. So if we have a look at our spine here, you can see we have our nice healthy discs. And then at the back here, we have, let's see if I get this close to the camera. We have these joints which are right here. You see they open, close, and they rotate around. If they're irritated, a bit inflamed, they're going to cause pain in all those movements like you're feeling. Now, the true question is, what's caused all this, Mr. Jones? So from what we discussed, it seems work has been the contributing factor. Being in awkward positions for extended periods of time and performing hard physical labor can put strain on the body and cause these type of injuries. So nothing that's out of the blue for you. It is explained, which is a good thing. So now we're going to talk about the plan of management. So the plan management is soft tissue therapy, spinal manipulative therapy, and rehabilitation exercises. So soft tissue therapy will be targeted massage and stretches to the affected muscles to help loosen them up. Spinal manipulative therapy is a chiropractic adjustment and will be implemented on your spine. Have you ever had a chiropractic adjustment before, Mr. Jones?
No.
Okay, so I'll give you a brief explanation of what it is so you have your head around it.
Yeah.
So what we do is place a small force through a segment of the spine. I'll get the spine up again to help it go from being restricted to normal motion. So just on a segment like, in your back, down here in this lower region, what we will do is we would just have the spine, we would rotate it a little bit, and a small force would be done just to move it a little fraction just like that. Now, when we're performing these adjustments, you might hear a click or a crack, or might have heard that's what we do. But when that's occurring, it's really only about 1 to 2 millimeters of movement throughout the spine when that happens. So don't be too concerned about the noises that happen if things it's damaging. It's actually not doing that. Rehabilitation exercises will be specific exercises, stretches, or lifestyle education to help recover from this complaint and prevent it from reoccurring again. And now we'll speak about, how much I want to see you for how long. So I'd like to see you 2 times per week for the first 2 weeks, and then weekly for 3 more weeks. I expect to see good results and improvement in your condition over that time. I don't think there's any really need for any further investigations here. I mean, we've already seen one view of the X-ray. Doesn't seem to be too many salient findings there or abnormalities. So it all seems in good order, so there's no need for that. Now I'm just going to talk about the risk and benefits of you, just so you can get a bit of a grasp on, what you're getting into with this. So as with all healthcare modalities, there is associated risk, and I'm obliged to share with you this information so you can make an informed decision on the treatment. As we're working on the muscles in your mid to lower back, there is potential of muscle soreness and also bruising post-treatment. Additionally, we're working on the joints in your mid to lower back, so there is chances of damage to your spinal disc or bony fractures. The chance of these occurring is very low, and they are considered a low risk category, and have been further mitigated through your history and physical examination, placing you in the low risk category for these events occurring. You're a young man, you're in good physical shape, so we're not too concerned about these things happening to you. With terms of, damage to discs, bony fractures, that would be something we're more concerned about in an older person, so someone with osteoporosis, bone degradation. Now, we've got to speak a little bit about the benefits of chiropractic care. So chiropractors are well known to treat conditions just like yours, and they've had great success in doing so. I think this proposed treatment plan will have great results for a case just like yours. Your prognosis is in the excellent category. The reasoning behind this being your young age and the simple nature of your presentation, having no complex sort of presentation. Potential barriers to recovery include frequent occupational stress on your body. So, how you previously described in history, being in those bad positions for extended periods. We just want to try and, get your posture into a better position, put less strain on your body during those times, and I think it'll be really good for you. Now, just because you're in this treatment room with me, don't feel like you're stuck with me. We're not tied to each other. There's many other practitioners that can assist you with a condition like this. So people like a GP, physiotherapist, massage therapist, they all can have some improvement on your condition. So don't feel like you're just stuck with me. With your case as well, what happens if you don't receive care at all? So if you don't receive care at all, it's been a long-standing condition. It's followed quite a linear path of staying around the same, hasn't got too much worse. So it'll probably stay around this level and maybe get a little bit worse. It's not a life-threatening condition, so don't feel like if you don't get treatment, you're going to pass away from it. Do you have any questions regarding any of this, Mr. Jones?
Not at the moment. No, it's all going swimmingly.
That's good. So what I'll get you to do is I'm just going to get up the form that I have prepared for you already, just so you can take this home to your family. So you can also share it as well. I'll put this up at the end of the screen here. So what that is your report of findings. Go home and show your lovely girlfriend, show your mum and dad as well. And I'll get you right now to take a read through our informed consent and give that a sign. If you have any questions, please ask.
Beautiful. Thank you very much.
Thanks, Mr. Jones.
Thank you.